This video is for a few little tips as far as application goes for the VQ Orthocare TRUlign OA wrap brace. I'm also going to get into a bit about how you know how much correction to put in, if you need to adjust, add or take off correction in the future. So first thing you do, of course, is open up the brace. The little clips are in front. Wrap. It's got the pull tab on the bottom corner as well. Open the brace up. The adjustability is in the Q hinge. The Q hinge is used adjusted by the actual Allen key, so you can put the brace into neutral. That's what we want the arm is to be in neutral when you apply the brace. So when you're applying the brace, make sure the patient is always sitting, putting the brace on, knee in a partial bent position, 35 to 45 degree angle. Okay, so the hinge is always applied laterally. To open up medial compartment, we're pushing the knee open. To unload the lateral compartment, we're pulling the knee open. So application wise, always have the wrap. I always start at the bottom first. Okay, so we're going to apply the wrap. So you're going to snug it up, just snug, don't over tighten it. Keeping the hinge as far posterior as possible. The actual material should be just sitting right below the kneecap. It makes it easier to apply as high as possible. We want it up as high as possible for sure. Then you do, of course, the top wrap. Again, just snug in place. What I do then is I go back and just readjust it. So I have the pull tab. I'm just going to snug it up a bit more. You never want to over tighten these braces. You just want to snug them up to actually just to hold the brace in place. Then we're going to start with the bottom strap. Always pull the strap up to sit above the calf muscle. The reason is we want to keep it anchored so it doesn't slide. The clip you want to apply across the front of the leg and into the snap. All the straps are adjustable. Both straps are adjustable, so you can pull it to snug it up. If you need to cut the strap, the tab here is an alligator clip, so you can open it up and cut the strap to adjust it to the right length. So tightness wise, always hold the hinge down and snug it up. Then you do the top strap, same idea. Apply it to the clip, hold the hinge down, snug it up. Okay, so again, you want snug. You don't want to over tighten it. If you over tighten it, it will just cause muscle issues and you don't want that. So how do I know if there's the right amount of correction? What I do is I take my Allen key, I go to the Q hinge and I dial in correction. The idea is we want to make sure that you're getting a good push. So as you tighten it and be counterclockwise, you feel the pad move and the patient feels that pad hit the outside of their leg. Don't want a big push. As long as it's snug to start, that's where you start from. Okay? So from there, get the patient to stand up. The brace will readjust itself. What you're looking for is that the pad on the lateral side should give pressure on the outside of the leg. How do you know if you're getting pressure? As a fitter, I have the patient shift their weight over to that leg, and I put my finger behind the back of the brace, the posterior side at the condyle pad. If I can't get my finger underneath that pad, that means we're getting a good push. The patient will say, yeah, I feel the push. So that's enough correction. We're not trying to overcorrect. We're only trying to unload the knee to slow the wearing and keep these patients active. Now, how do you know if you have too much correction? If you apply the correction, and at the top of the actual brace, there's a gap. I can get my finger underneath the actual sleeve here. That means there's too much correction. It's not doing anything for the patient, it's just pulling the brace away from the leg. How do you adjust the correction that way? Do the opposite. When you have them weight bearing, turn the key the opposite way to bring the arm back against the thigh and make sure that there's still pressure in the back of the pad. So I'm going to put the key in. Open it up a bit, sitting tight against my thigh, feeling if I can get my finger underneath. I can't. That means you have a right amount of correction. If it's the opposite, if you have not enough correction, how do you know? If you put your finger in the back of the pad and you can slide your finger underneath that pad, that means you need to add correction. So what you have the patient do is sit back down, dial in the correction, have them stand back up again, check to make sure there's no gapping at the top, making sure that now you can't get your finger underneath the back of the pad. That's the appropriate correction. Again, we're not trying to fix their knee. We're just unloading enough to slow the wearing and keeping them active.